In this program entitled Anesthesia Assisting, you'll be introduced to the field of veterinary anesthesia and gain a better understanding as to the valuable role you may play in assisting the veterinarian. This program will introduce you to the following areas of anesthesia: patient evaluation prior to anesthesia, the pre-anesthetic phase and medications, the induction phase, anesthetic equipment, patient monitoring, the anesthetic maintenance phase, and finally the recovery phase. When care and attention are directed towards each of these phases, our veterinary patients will experience the safest possible anesthesia. Before we begin our discussion on various anesthetic phases, let's define a few basic terms. What do we mean when we say anesthesia? Anesthesia is defined as a loss of sensation. Local anesthesia, a form of anesthesia, is produced when the pain-blocking drugs are injected at the site where the procedure will take place. Local anesthesia might be used when a superficial or localized minor surgical procedure needs to be performed on a patient that is not likely to move around a great deal. Drugs such as lidocaine are injected below the skin and create a localized numbing effect for several hours. General anesthesia is utilized when it becomes necessary to have the entire animal completely asleep or unconscious. General anesthetics produce three important effects, including hypnosis or unconsciousness, muscle relaxation, and analgesia or pain relief. During general anesthesia, the patient should be free of feeling pain created during the procedure. This type of anesthesia is commonly used in veterinary medicine. It can be produced by the administration of one or more drugs and is the principal focus of this program. Let's now examine each of the phases of anesthesia as they apply to one of your patients in need of a surgical procedure. We'll begin with patient evaluation. Good communication with the owner is essential. The procedure is described to the owner, and they are given an opportunity to ask any questions they might have pertaining to the surgery or the anesthesia. They will also sign a release form acknowledging that they understand that with any anesthetic or surgical procedure, there are risks of complications or even the possibility of death. Though very unlikely, they do need to be made aware of such possibilities. They may also be given options regarding the pre-surgical testing procedures many veterinarians recommend. Such tests often include a blood analysis designed to help screen out those patients that might have a health problem that could lead to an unpredictable anesthetic response or even death. This pre-surgical blood testing might include measuring blood cell counts, the protein levels in the blood, evaluating blood for adequate clotting, and evaluating the health of various organs such as the kidneys and liver. The veterinarian will also do a thorough physical examination of the patient. This evaluation will include a consideration of the excitement of the patient's age, the hydration status of the animal, the patient's temperature, and thorough auscultation of the heart and lungs. Heart rate, respiratory rate, capillary refill time, and adequate pulses are just a few of the variables the doctor will evaluate. Additional diagnostic tests, X-ray, blood sugar, may be performed in very young, old, or animals with signs of disease. Patient evaluation also includes a careful consideration of these important facts: the physical status of the patient. In other words, is the patient currently ill? A history of any illnesses, any medications that the patient has been given recently, particularly organophosphate parasite medications, painkillers like aspirin, cardiac or behavior-modifying drugs, and the amount of pain the patient is likely to experience as a result of the surgery. Another safety measure taken to reduce complications is the withholding of food and water 10 to 12 hours prior to the anesthetic being given. Such precautionary measures will reduce the likelihood of an animal vomiting while unconscious. This is very dangerous because it may lead to the inhalation of vomit into the lungs, leading to pneumonia or suffocation. Next, we will discuss the pre-anesthetic phase. Once our patient has been evaluated and the pre-surgical test assessed, the veterinarian will determine which pre-anesthetic and anesthetic drugs will be used. Pre-anesthetic drugs are used to calm or sedate the patient prior to producing unconsciousness. They are an essential part of every anesthetic protocol and help to reduce the amount of intravenous or inhalant anesthetic drugs required to produce unconsciousness. Many pre-anesthetic drugs also produce muscle relaxation and analgesia, in addition to their calming or sedative effects. By considering the animal's physical condition, the type of surgical procedure to be performed, the length of the anesthesia required, and the amount of pain the patient has and is likely to encounter, the veterinarian can make informed choices regarding appropriate drugs and dosages. All of the medications used will need to be recorded in the medical and anesthetic record. The anesthesia record contains important patient information and allows the anesthetist to record vital information like heart and respiratory rates during the surgical procedure. The anesthetic log is used to record amount, dose or volume, of each drug administered, especially controlled substances. In this situation, the veterinarian has chosen to support the heart circulation by maintaining the dog on IV fluids during the procedure. The IV catheter also provides easy access to a major blood vessel, allowing the general anesthetic drugs to be safely administered directly into the bloodstream. In the event of an emergency, an IV line is now available for emergency drugs to be given. Several drugs may be given prior to the general anesthetic. These are called pre-anesthetic medications. The administration of analgesic drugs before surgery is termed preemptive analgesia and is done to make the patient more comfortable and reduce the amount of drugs administered to produce general anesthesia. In many cases, a sedative or tranquilizer will be given 15 to 60 minutes prior to the general anesthetic to calm the patient and allow for a smoother anesthetic conduction and recovery from anesthesia. Some sedatives may aid in pain management, or additional pain management drugs may be given during or following surgery to make the patient less painful and more comfortable. Other drugs such as atropine or glycopyrrolate may also be given during the pre-anesthetic period to decrease salivation and maintain an adequate heart rate. An emergency drug kit should be readily available and restocked regularly in case an anesthetic emergency should occur. Become familiar with this emergency kit and its contents before a crisis arises.